cutaneous femoris posterior. There are two long branches, yes? When you will explain with topography. Don't explain shortly. This nerve goes in nerve these muscles. We will explain topography in details through along what muscles, between what muscles, what branches, in what canal. Das nervus ischiadicus. It arises from foramen infrapiriforme as direct continuation of what plexus? Plexus sacralis. Direct continuation is, attention, nervus ischiadicus, moderata, nervus ischiadicus, direct continuation plexus sacralis. It arises from foramen infrapiriforme together with nervus gluteus inferior, nervus pudendus, nervus cutaneus femoris posterior, and vessels which accompanies this arteries. We have also artery and vein which accompany comitans nervi ischiadici, accompany this nerve. So big nerve accompanies with arteries which supply. This nerve passes between nervus gluteus maximus. It goes at first on obturatorius internus, gemellus superior, gemellus inferior muscle, and supplies this muscle. Then it passes on, listen, so you will explain. It passes between, covering by gluteus maximus, it passes on obturatorius internus, gemellus superior, inferior. Then it passes on quadratus femoris muscle. Then it lies on the thigh between adductor magnus and semimembranosus muscle, then between semitendinosus semimembranosus muscles, and long head of biceps femoris, and supplies all these muscles. Posterior group semitendinous semimembranosus, long head of biceps femoris, and adductor magnus muscle and so on. And of course quadratus femoris and so on. Approximately on the level of low foot of the thigh, maybe more superior level of division. Ischiadicus divided in two nerves, nervus tibialis, direct continuation, and nervus peroneus communis. Now we will continue. This ischiadicus supplies only muscles of posterior surface. Skin, flexor muscles of knee joints. Skin is supplied by nervus cutaneus femoris posterior. Nervus tibialis is direct continuation of the femoralis, ischiadicus. It passes in popliteal fossa together with vena popltea, arteria popltea. Nerve is most lateral structure, nerve, vena, arteria. Arteria is most medial, deep structure. In this rhomboid in shape popliteal fossa, if you will connect the sharp angles of this rhomboid fossa, popliteal fossa, it is rhomboid in shape popliteal fossa. Here the artery passes just on mid-half of this fossa, then vena and nervus, or from the lateral side to medial, nerve, vena, arteria. What nerve? Nervus tibialis. What artery and vein? Vena and arteria popliteae, but nervus tibialis. Remember abbreviature. Okay. Abbreviature of this fossa. NEVA, NEVA, nerve, vena, arteria. NEVA. NEVA is a river in St. Petersburg. It is for Russian students, especially more easy to remember. Neva. Did you anytime visit St. Petersburg? Neva, da? Neva, Neva. Nervus tibialis nerve, which supplies in popliteal fossa, gastrocnemius muscle, and where the other students? Popliteus muscle and plantarius, and also gives cutaneous branch, nervus cutaneus surae. Surae is calf region. The posterior region of the crus is called surae. It gives nervus cutaneus surae medialis to the skin of posterior region of the crus. Nervus peroneus communis also give nervus cutaneus surae lateralis. They join together and form nervus suralis, which reaches the little toe of the foot. Nervus suralis supplies the dorsal lateral surface of the crus and dorsal lateral surface of the foot. It is formed by junction nervus cutaneus surae medialis, nervus cutaneus surae lateralis. This both nerve gives two skin branches. Nervus suralis formed. You remember on medial side what nerve passes from femoralis? Saphenous. On lateral side, suralis. Tibialis is direct continuation of ischiaticus. Through the popliteal fossa supplies the muscle, then it passes in adductor canal. Oh, sorry. In adductor canal, I would want to remind you, in adductor canal, nervus saphenus, and in cruropopliteal canal, Gruber's canal, passes nervus tibialis. This canal is Gruber's canal, or cruropopliteal canal, cruropopliteal. In this cruropopliteal canal, pass nervus tibialis with arteria vena tibialis posterior. The posterior tibial vessels and nervus tibialis pass in cruropopliteal. Where is adductor canal? Adductor lies on the thigh. Nervus saphenus passes. Or femoropopliteal. It is formed by adductor muscles. That is why it is called adductor canal. By Otter, Hunter's canal. And topographical name, femoropopliteal canal. This canal is cruropopliteal canal, cruropopliteal. It lies between soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus muscle, in this canal, nerve with the vessels. Thus supplies all this flexor posterior group of muscles, flexor muscles, and then it passes behind medial epic malleolus, malleolus medialis in medial canal, and goes to the...
Если вы читаете.
Я никогда не читала череп. Зачем мы дали новые лекции?
А кто читает? Федорченко, да?
Наверное. Переставьте.
Он читает, да? Он читал, да?
Не давай, Настя.
Нет, я говорю, он читал.
Он читал, наверное. Надо его